Good morning. This is Dr. Zachariah here with ShuraTV out on our health program. I wanted to welcome everybody. Today's February 1st, and it's the beginning of a new month. It's February. It's one of the months that's known for, of course, in the U.S. as Black History Month, as well as in the medical field, it's Heart Health Month. So we wanted to discuss some issues with heart disease and try to get some of those things squared away for you. Before we do that, thank God the numbers for the COVID-19 Omicron are going down, and people are doing better. And that's something that's always a positive light. And what we wanted to do is highlight the fact that the youngsters between 5 and 12 are getting the vaccines. The numbers are increasing, and that's something encouraging because they're all in school, and a lot of the adults are now getting Omicron from their children. So it's very important that we get them the vaccines necessary to protect them and protect ourselves and protect society in general. If you're not vaccinated, please go ahead and get vaccinated. If you're not boosted, please get boosted. That's the only way that we will move ahead and go beyond COVID, inshallah. So that's that. Of course, what we want to do is discuss heart disease. Okay, heart disease, of course, we'll discuss some of the symptoms, some of the causes, and some of the treatments of general heart conditions that are out there. For any specifics or any specific information that you need, always consult your own physician and set up a meeting or a time or an appointment with them, your family physician, and then hopefully they can get you specific treatments and specific referrals so that you have good heart health. That's very important to keep in mind. Of course, with like anything else, heart disease is also connected to our genetics, right? If you are someone that has someone in the family that has had heart disease, a grandmother, a grandfather, an uncle, an aunt, someone like that, then your chances are more likely to have heart disease as your life progresses. So that's something where we have to keep in mind. You're more likely to get heart disease if someone in your family has had it before. So you have a predisposition to it, okay? And as you get older, the likelihood increases as well. Women who are 55 and older and men who are 45 and older are at higher risk of getting heart disease than those at a younger age. So that's something to keep in mind. That's why as you get older, you want to be more attentive to your schedule of screenings with your doctor. That's very important because anything that you catch early, you can get the diagnosis early and you can get better treatments rather than waiting till your arteries are clogged up 90% plus, and then you try to get intervention or surgery and things like that. It's much better if you do preventive measures early on. So for women, if you don't have a predisposition or a prehistory of it, then it's very important to keep your screenings and everything on task. So please keep that in mind. For men, it's 45, the cutoff, and for women, it's 55 and older. So men generally in their early 40s should get that screening as soon as possible so that you make sure that you have longevity in terms of heart disease and you get ahead of it rather than behind it. That's very important, and that's something which you should keep in mind. Some signs and symptoms, right? Of course, we know that the obvious sign is anyone that gets pain in the center of the chest that's not due to acid reflux or some other stomach condition or nerve condition or musculoskeletal condition where on movement it improves and gets better. That's something to report to your doctor. So please keep that in mind. The pain in the chest area, that's the number one thing you look for. The other thing that you can look for is swelling of the feet. Swelling of the feet is very important. That's something where it lets you know that uh, that there's a pumping issue, or you're not moving enough fluid in your body. And your pump, of course, for the body is your heart. So if you're getting swelling of the feet, that's something to look into, especially if you're not obese and you have no other conditions. You're just getting swelling of the feet, what they call, sometimes it's called pitting edema, where when you press it, it goes in and stays in and then comes out. You see a lot of water that's there. So that's important to keep in mind. And then also, it's important to keep in mind that some people will get trouble breathing. They'll get shortness of breath. Exhibit when they have some sort of heart disease. It's very important to keep that in mind. And also a general feeling of weakness. When people feel a general feeling of weakness, and you can't attribute that to lack of food, lack of sleep, other attributions, then you want to make sure that your heart is okay. And the other obvious thing is palpitations. Palpitations are irregular beating of the heart that you feel. A lot of people will feel that and will say, hey, my heart is racing, or my chest is beating in an irregular way, or you just don't feel right. A lot of people get that premonition, and then they'll get tachycardia or bradycardia. Tachycardia being a very fast heartbeat, and bradycardia being a slow heartbeat. So these things are all issues which point to the heart and need a serious assessment and a quick visit to the doctor, so that they can make sure that you're feeling okay and everything's in normal functioning. So that's something to keep in mind. The other issue is also what's known as cyanosis. Cyanosis is something where you get blue lips, blue blue lips. Some people get fingers. Some people they get these things where it's very obvious that they're not getting enough oxygen. If they're not getting enough oxygen, oxygen is key. Of course, you know that the blood pumps the oxygen to all organs. Sorry, I'm getting a little message here that I think the battery's going low on my screen here. So I'm going to plug this in real quickly with this.
Please join us for an educational home buying and Islamic financing webinar being organized for Shura Council members and subscribers. This event will be conducted by Ijaz Hussain, Senior Vice President Sales and Director of UIF Corporation. This event will take place Thursday, September 9th at 6 p.m. Pacific Time. You must register to attend this event. Thank you.
Purple lips and fingers, which indicate that there's a lack of oxygen. So that's something that you need to be aware of. Anytime you see that in someone or somebody that's happening that way, then you want to make sure that they're getting their heart assessed, because it's not pumping enough blood or properly. So that's something that we have to keep in mind. Okay. So number one, congenital heart disease, right? It's caused by medications, genes, or medical conditions when the baby is in the womb. These are things that you really don't have control over. These things happen to you because of your genetics, because of your conditions when you were in the womb, inside your mom. So these things, you don't have an issue. These are congenital heart issues. Okay. And then we have cardiomyopathies. Cardiomyopathies are things that are caused by things like high blood pressure, ischemic heart disease, trauma, radiation, heart attacks, infections, different types of surgical procedures you might have, or you might have autoimmune disease. If you have autoimmune disease, then these things also cause this type of what's known as cardiomyopathy. The muscle of the heart itself becomes diseased. And those are things that are preventable. High blood pressure, you can do things for going against the sedentary lifestyle, making sure that you don't have high blood pressure. You're not in a sedentary lifestyle, so that you're doing a lot of exercise. Your vasculature is expanding. Your blood is flowing, and there's not too much pressure against the blood. That's one thing. In terms of ischemic heart disease, same thing. Ischemic heart disease, we know that some of these causes of these things are high saturated fats in the diet, sedentary lifestyle, as I mentioned before, lack of exercise, not really paying attention to your intake and what you're getting in terms of your consumption of proper foods, proper fats and proteins, the balancing of the diet. That's very important to keep in mind. So those things are important. There's also, then we have the arrhythmias. That's a whole different category. These conditions are usually where the mechanism of the flow and of the pumping of the heart is obstructed, or it's increased or decreased, the arrhythmias. A lot of people have this issue in older age. Some people have it younger age. Then, of course, in the young people, it's usually caused by, in this country, in the West, in the US, by drug abuse, people that are drug addicts or have been tampering with a lot of drugs and early on in life. They have heart palpitations and heart issues and arrhythmias. Another simple culprit that's in everyday life is coffee. Coffee's there. It's a big economic source for people to make money with, all these coffee shops. But caffeine is a stimulant, so it does increase the heart rate, and prolonged use of caffeine and excessive use will cause different types of heart conditions. This is something where you have to be aware. A lot of younger people now are taking coffee at much more younger ages because of the marketing. They go to Starbucks or these Tim Hortons or whatever coffee shop there is. Mostly it's Starbucks because of the marketing, and they think it's a cool thing to have coffee, which it is not. One cup a day, maybe it's fine, but if these people have 3 to 4 to 5 cups of coffee a day, and caffeine is the main culprit. Also, caffeine has been in these monster drinks. These young people get these energy drinks that are Monster and other things. These things have high loads of caffeine and other chemicals that are detrimental to the heart. So this is something important to keep in mind. If your youngsters or your family or friends or anyone you know is taking those monster drinks to keep up and awake and stimulated, that's a bad thing. That's going to affect their heart. Several reports of people having heart attacks from those drinks. So that's something important to keep in mind. And then, of course, if someone has any physical defects in terms of the structure of the heart, they'll have arrhythmias as well. And diabetes also can lead to arrhythmias, alcohol addiction, smoking, caffeine. These are all addiction-based things that affect the heart. You have smoking, you have caffeine, alcohol, drug abuse. These things cause arrhythmias in the heart. So I would encourage you to, if you're someone that takes a lot of caffeine and coffee or these energy drinks, to slowly wean yourself off of those things. It is not good for the stability of your heart, and it'll also, in turn, it'll make you anxious. Anxiety is something that comes from this as well. So those are the things that, the 3 categories: congenital, cardiomyopathies, and arrhythmias. Let's discuss some simple treatments because our scope here is very limited. We're discussing some basic things. Of course, congenital heart disease, treatment is usually done with medication or surgery. There's no other issues that we can do. Same thing with valves. If people have valve issues, the heart valve surgery is used to replace or repair the valve. that is behaving abnormally. Those things happen. And then, of course, the most common thing that you hear of is bypass, coronary artery bypass, which is a cabbage. These things are treated with medications, beta blockers, aspirin, ACE inhibitors, and it might require surgery or surgical intervention, or what they call nowadays is the cardiologist. They have interventional cardiologists that put stents in the small arteries of the heart to keep them open and keep blood flowing and keep you feeling good. So that's and then medicated stents, and they last, some of them last 10 to 15 years. Technology is improving every year. So slowly they're going to get away from surgery, except for the severe cases. Open heart surgery or balloon angioplasty, we know, right? And stenting. Those are the things for coronary. Cardiomyopathy. Cardiomyopathy is the general disease of the muscle of the heart that eventually will need a transplant, eventually. But it depends on the severity of your condition and how you've dealt with it through the years. Arrhythmias are usually treated with blood thinners, because the goal with blood thinners is to prevent clotting of the arteries and clotting of the blood in different places. Okay, and then of course there's a thing called cardioversion, where they shock you so that your electrical beat normalizes in the heart. That's something that they can do. And then of course electrophysiological studies and what's known as ablation techniques. They'll go in and they'll disconnect some of the nerves so that the intensity of the beat is slower, or the beat gets regular. That's something that we can do. And then there's also what's known as pericarditis, right? Inflammation of the sac of the heart. There's a little sac that your heart sits in, and that sac gets inflamed. If that gets inflamed, they'll give you anti-inflammatory medications. They'll drain the fluid in it. And then also there's surgical things that they can do, and they'll also give you some steroids. So those are the gist of the diseases of the heart. Now, the most important thing that I think we can do as people living in a Western lifestyle with a Western food and diet is, number one, try to decrease our stress. Number two, increase our exercise. Number three, pay attention to the types of foods we eat. It's very important. Very important. You want to eat good fats. You don't want the saturated fats. You want good fats. You want good proteins. You want whole foods. These things will help your body process all the nutrients much better and absorb good nutrients and not clog up your arteries. This is very important, these two things. Again, the other thing that you should look into is, if you do have heart issues, the best type of food for the heart, if you have issues, and in general as well, if you don't have issues, is the Mediterranean diet. And the Mediterranean diet is something that you could look into and see what are the components of that. We'll have a discussion on that another time, but that is the best that you can do. And then, of course, intermittent fasting is a very popular thing that's happening now. That has great benefits for the heart as well, and it decreases the load on the heart when it's not pumping so aggressively. So those are the things that we want to make sure that you understand. Again, discuss these things openly with your primary care physician. They'll refer you to a specialist. Check your heart health, make sure that everything's okay. It's the beginning of the year. It's February 1st, and it's Heart Health Month as well. And we want you to make sure that you take care of that aspect of your body, because your heart is the central organ that pumps blood and nourishes all your organs with oxygenated blood. So that's important to keep in mind. And if you keep that in mind and go to your doctor and get this taken care of and make sure you have good heart health, then the rest will follow as well. In the US, 25% of all deaths due to disease is from heart disease. So that's very, very important. So 1 in 4 people in the US, when they die from heart disease. That's something very, very tragic, and it's reversible. Heart disease, except the congenital things, everything else is reversible and preventable. So it's in your hands. You can take charge and be an advocate for your health and take care of your heart. It's very important. And of course, there are anti-inflammatory foods that help with heart disease. These things we can look up and we'll discuss at another time. But it's important to keep that in mind. And just like your other muscles in the body, you exercise, your heart is a muscle. So remember that. So you need exercise to get it a little bit in good condition. You don't want to overdo it, but you want to at least keep it primed so that it's in an optimal way for you. Okay. Any other issues with the heart? If you have any questions or comments, please feel free to ask questions in the comment sections, and we'll get back to you. And your heart is a very busy organ. It's pumping consistently. So that's something, for anywhere from 70 to 85 to 90 years of your life, consistently pumps the blood, that muscle. And it's contracting and lub dub, right? Contraction, recontraction, and relaxing. And it pushes that blood through your organ. So that's very important. And we hope that you're cognizant of it. You take care of yourself and your heart health. And if you have any issues and questions, please don't hesitate to ask. And then we'll see you next week. Thank you for having us today and listening to us. And hopefully you get something useful out of this simple lecture. Take care. Bye-bye.